Southern China is facing a major public health crisis, a sudden and alarming surge of chikungunya, a mosquito-borne virus that causes fever, joint pain, and severe fatigue. The disease, once rare in this region, has now become a significant threat, catching both residents and health officials off guard. Since July, over 7,000 cases have been reported in Guangdong province alone, overwhelming local hospitals and putting immense pressure on medical staff, who are working around the clock to care for the sick. The city of Foshan has emerged as the epicenter of the outbreak, but the virus is not contained. It has rapidly spread to at least a dozen other cities, turning what began as a local outbreak into a full-blown regional emergency that threatens millions. The outbreak's rapid escalation has triggered urgent travel advisories and heightened global concern. Worries intensified after Hong Kong reported its first linked case, a 12-year-old boy who had recently returned from Foshan, raising fears of further international spread. This isn't just a local issue. Similar outbreaks are now appearing in other parts of the world, echoing patterns seen during a major global epidemic 2 decades ago. The interconnectedness of today's world means diseases can travel faster and farther than ever before. Experts warn that climate change is expanding mosquito habitats, increasing the risk of outbreaks in new regions. Warmer temperatures and heavier rainfall are creating ideal breeding grounds, putting more people at risk than ever before. The world is watching closely as China races to contain the spread, mobilizing public health teams, researchers, and community leaders to protect its citizens and prevent further escalation. The stakes are high, and the outcome of China's battle with chikungunya could shape how the world responds to mosquito-borne diseases in the future, setting a precedent for global health preparedness and cooperation. Chikungunya is a viral disease named for the severe joint pain it causes, often leaving patients stooped in agony. The word chikungunya comes from the Makonde language, meaning to become contorted, which describes the bent posture of those suffering from the illness. This disease can strike suddenly, making even simple movements excruciating for those affected. First identified in Tanzania in 1952, chikungunya has since spread rapidly and is now found in over 110 countries across Asia, Africa, Europe, and the Americas. The virus is transmitted by Aedes aegypti and Aedes albopictus mosquitoes, the same species responsible for spreading other dangerous diseases like dengue and Zika. These mosquitoes thrive in both urban and rural environments, making outbreaks difficult to control. The virus spreads when a mosquito bites an infected person, picks up the virus, and then transmits it to others through subsequent bites. This cycle allows the disease to move quickly through communities, especially where mosquito populations are high. Symptoms hit hard and fast: high fever, intense joint pain, rash, headache, and fatigue. Many patients also experience muscle pain, swelling, and nausea. The sudden onset can disrupt daily life, forcing people to rest for days or even weeks. While most people recover fully, joint pain can linger for months or even years, especially in older adults or those with chronic health conditions. This lingering pain can impact mobility and quality of life long after the initial infection has passed. Chikungunya is rarely fatal, but it can be devastating for newborns, the elderly, and people with pre-existing illnesses. These vulnerable groups are at higher risk of severe complications and require extra care and attention during outbreaks. There's no cure, only supportive care to manage symptoms, so prevention is critical. Measures like using mosquito repellent, installing window screens, and eliminating standing water can help reduce the risk of infection. Protecting vulnerable groups is a top priority during outbreaks like this, and community efforts play a vital role in stopping the spread of chikungunya. Why Guangdong? Weeks of heavy rain and high humidity have created perfect breeding grounds for mosquitoes in urban areas like Foshan. Dense populations and abundant standing water in cities make it easy for the virus to spread rapidly. Climate change is expanding the range of Aedes mosquitoes, bringing diseases like chikungunya to new regions. Increased global travel means an infected person can spark outbreaks far from the original source. The Foshan to Hong Kong case shows how quickly the virus can cross borders. Coordinated surveillance and response are now more urgent than ever. In areas where outbreaks are occurring, everyone is potentially at risk of infection, regardless of age or background. However, certain groups are especially vulnerable and need to be extra cautious. This includes the elderly, newborn babies, and people living with chronic health conditions such as diabetes, heart disease, or weakened immune systems. These individuals face the greatest danger from severe symptoms and complications. The most important warning signs to watch for are a sudden high fever and intense joint pain, which can be debilitating and appear quickly after infection. These symptoms are often followed by a distinctive rash that may spread across the body, sometimes accompanied by swelling or redness. If you have recently been in an outbreak zone and start to notice these symptoms, it's critical to seek medical care immediately, and be sure to inform your healthcare provider about your recent travel history. While most people recover fully, some may experience lingering joint pain and stiffness, which can persist for months or even years, affecting daily life and mobility. There is currently no specific antiviral treatment. Management focuses on getting plenty of rest, staying well hydrated, and using pain relief medications as advised by a doctor. Early diagnosis and supportive care are especially crucial for those at higher risk, as they can help prevent complications. Remaining vigilant and acting quickly at the first sign of symptoms can truly save lives and protect the most vulnerable in our communities. China's response is aggressive, isolating patients, spraying insecticides, and using drones and mosquito-eating fish to target breeding sites. Residents are ordered to eliminate standing water, with fines for non-compliance. Personal protection is vital. Use repellents, wear long sleeves, and sleep under nets. Even a bottle cap of water can breed mosquitoes, so check your home regularly. Combating chikungunya requires everyone's participation: governments, health workers, and communities. Stay informed, take precautions, and support each other. This outbreak is a wake-up call for our interconnected, warming world. Together, we can control the spread and build resilience for future health threats.